everyone. Just wanted to share a little bit of information from last week's discussions and quizzes. Last week we talked a little bit about how stakeholders are involved in the policy process. So we've talked thus far about how the policy process kind of progresses along. We have maybe legislators involved in policy. We have perhaps regulators developing policy, that RFI process, proposed rules in that same manner. We talked a bit about that. So that's kind of those first steps. But this past week we talked more about how various stakeholders kind of dig into these various policy like promotion or those types of things. So we might have stakeholders, so let's say at the federal level, we may have stakeholders such as the American Medical Association, the American Hospital Association, those types of interest groups that really play into how legislation occurs. You might have researchers. Researchers, unfortunately, aren't as impactful. You would think that it would be more impactful. They aren't as much. But researchers can help to play a role in the development of health policy. But I think ourselves, citizens, we can really play a role, and that is really important moving forward, that we understand our role in the development of health policy and how those health policy decisions really can be impacted moving forward. We did take a look at the Allegheny Community Health Assessment, Allegheny County. Know that I chose Allegheny County, or it was chosen just simply because of location, but those types of documents exist for counties all over, all over the country. So I would suggest that you don't live in Allegheny County. I know that that's not the case for a lot of you. Feel free to dig into the community health assessment of your own county. You may find some interesting info in there. Allegheny County is also a nice example because it's a county that is it's quite broad. So there's low and high socioeconomic status. There's low and high access to care. It's very broad. Lots of different areas within the county. Very large county. So it's a good one to take a look at. But so in the discussion itself, interesting to take a look at, okay, well, here's the different types of topics that were discussed throughout the plan. Things like access to care, healthy aging, overdoses. I don't have the plan, actually. Maybe I'll bring the plan up. That would be, here we go. So it's going to load very slowly on me. Chronic disease, health promotion, injuries, maternal child health, sustainability, all these different types of things that are dealt with throughout the actual plan itself. But really what we're digging into for purposes of our discussion are, okay, who are the stakeholders that impact that? So maternal child health, great area to focus on. Who are the types of stakeholders? Well, it might be Children's Hospital, might be various different hospitals. It might be the milk bank. That's a great not-for-profit organization that helps out moms. So it could be that bank could help out moms that really are in need, that are unable to lactate and are in need of milk for their babies. You might have organizations like La Leche League, or who knows what. You can have all these different types of nonprofits that can help out. There might be local organizations that can help out with things like moms and babies that may need care, may need prenatal care, moms that are in need of that, may need clothing for babies, families that don't have clothing for babies and infants. So those types of things could come into play. You may also have situations where you have a lack of access to care. So you may have transportation issues that you need to deal with. So there's all kinds of stakeholders that can come into these processes. And when you're looking at a wide topic area, it's about brainstorming. Okay, well, who are the interest groups? Who are the stakeholders that are involved in this topic area? Let's bring those stakeholders together, and maybe we can look to solve these issues moving forward and make a change, so that the next time we do this community health analysis, community health assessment, maybe maternal child health won't be as much of a problem, or maybe we will have solved the transportation issues, so we won't have to deal with that. Maybe we'll have a great Uber plan in place where Ubers are able to take moms for their prenatal visits, and we won't have to worry about that, or bring babies for their checkups with the pediatrician. So just some just off the top of my head, some thoughts on how we might be able to approach that. Also, we had our writing assignment on the OneCare Vermont topic, so I look forward to taking a look at those as well. So our quiz questions, we'll take a look at those. I pulled 3 of them. So the first one is, until laws or amendments are implemented, they are, and there was 4 options. The correct one was only so much paper and rhetoric. And the reason this is the case, and we talked about this a little bit in weeks prior, but it was in the reading this week as well. So when you pass a law, it's just a law. It doesn't really have any, outside of the fact that it's just a law, it's really just on paper. It's just something that's written on paper. So it doesn't have anything to back it. And what you really need to do is implement it in some way. And a good majority of the time, the way that you implement that is through regulation. So, for example, HIPAA is a great example of a lot of different things. And we're going to spend, unfortunately, for those that aren't HIPAA fans, we're going to spend a little bit of time on HIPAA this week. But HIPAA is a great example in that the laws for HIPAA were written in 1996, but the regulations themselves were not written until 2003. Well, they weren't implemented until 2003. They were written slightly before that. So there was a big gap of time between the time the law was written and the time the implementation occurred. But so prior to that, it was really just the privacy security regulations. They were really, like this says, just paper. There was nothing in writing. There are actually still some parts of HIPAA, what they call the administrative simplification, that are still just paper. They've never been implemented. So there really are some parts of laws that just never get implemented, unfortunately. But it really has to go through that implementation process, that management process to get something in place, and oftentimes that requires a regulation to do so. The next question, Medicare is a federal entitlement program that only provides health insurance to people age 65 and older. And that's a true-false question. That answer is false. It is a federal entitlement program. It is considered, some people may have seen that and said, oh, well, you know, I'm unsure on that. It is considered an entitlement program, even though we do pay into it. But it's not, you don't get Medicare based on how much you paid in. A lot of people don't pay in a whole lot and use a lot of Medicare coverage. You do have to pay in a minimum amount, but a lot of people well exceed that amount as paid out in Medicare. So it is considered an entitlement program, even though you do have to pay premiums for Part B coverage. But it does provide health insurance coverage to not just people 65 and older. It does provide coverage to patients with disabilities and patients with end-stage renal disease. So it is more broad than just those with 65 that were 65 and older. The last question, established as part of the Affordable Care Act, this CMS center is responsible for conducting demonstration projects for new care models and payment approaches to enhance the quality of healthcare and reduce costs. So the answer to that is the Center for Medicare and Medicaid Innovation. And this center has actually been threatened. I think it's still functional. It was talked about in our textbook, and I'm pretty sure it's still functional at this point, but it has been threatened by President Trump to be shut down He's not a big fan of it or its plans or its programs. A lot of the programs it developed have been shut down, and I know he had threatened to shut the entire innovation center down. But it is a neat center that has been working hard to develop a lot of innovative payment models and payment strategies that they tend to put out as pilots. So, like the original Pioneer ACO project came out of the Innovation Center. The bundled payment models came out of the Innovation Center. A lot of really neat payment model pilots have come out of there. Just trying different things to see how we can decrease cost but maintain a high level of quality uh, in in the mainly for the Medicare patient population. That's typically where we're seeing a lot of these pilots at this point. But yep, so the answer is the Center for Medicare and Medicaid Innovation on that question. All of those different types of centers within CMS are listed in the textbook as well. So if you have any other questions, please let me know. Otherwise, I will see you all in the classroom this week. Don't forget, we do have 2 synchronous sessions. One is tonight, Monday night, pull up my calendar quick. Tonight at 6:30, and the next one is Thursday night at 7 p.m. And again, these are going to be a HIPAA-based case study discussion, so hopefully you'll find it interesting. And I did send out, I put out on the announcement today that they were up there too. So hopefully we'll get a good turnout for both of them. You only need to come to one, you don't need to come to both, but hopefully you can get to one or the other. So look forward to seeing everyone this week. Thanks so much.